Can I start? So
Yeah, please.
SICS is still relevant to us today. We think phaco is everything, but the tallest trees have the strongest roots. The advantage of SICS is it is a self-sealing sclerocorneal incision. The learning curve is less. It's a lower cost procedure than phaco. It's less machine dependent and less damaging to the endothelium. But the dilemma is that there is a 10 to 11 millimeter lens which has to be delivered through a 5 to 6 mm tunnel. So the difference between SICS and phaco is the sclerocorneal tunnel and the way you seal it. Everything else remains the same, and the conjunctival flap is also present in SICS. So that is what is different. So here is a very hard black cataract that you will be seeing, and in most of these cases, it is either the phaco time is more, there is lots of complications. So as you can see over here, this is a sclerocorneal tunnel which is made in an SICS wound. This is this is a funnel shaped incision which is made with a crescent blade. These black cataracts have leathery fibers. They are very thick. The ultrasonic time taken for these cataracts is high, and hence there is chance to damage the endothelium. These patients are very, very old too, and they do have compromised endotheliums. I would be still scared to do phacoemulsification in these patients. So these are the type of patients in which I would not advise, and I do not do phacoemulsification, and we are still faced with these kind of patients even today. As you can see, this is the cataracta nigra. This is the Blumenthal surgery being performed, and definitely this is an indication for SICS today. The surgeon is at peace, the endothelium is happy, and the patient is happy. Even though initially in phaco you may have good results, but over a period of time the endothelium will decompensate, and hence you need to reassess whether you should do phacoemulsification in these cases. This is the implantation of the IOL in this patient. So SICS also comes to the rescue if you have phaco complications where need to convert. So if you see this patient, we are doing phacoemulsification. It's a normal looking cataract, and you are leaving the zone of safety, which is the CCC, and before you know it, you have a complication and part of the nucleus falls inside the vitreous. You cannot do continued phaco because more pieces will fall in. As you can see over here, we were chopping in an unsafe zone and part of the nucleus has now fallen in. The rhexis is now extended because you want to deliver these pieces out, because you are not going to do phaco. In phaco, the rhexis would be smaller. So before we do anything, the rhexis is enlarged. A lot of viscoelastic is used to protect the endothelium, and now you can either suture what you do is you bring the nuclear pieces in the anterior chamber, extend this incision. Either the incision can be closed and a new sclerocorneal tunnel can be made, but even this can be extended and the nuclear pieces can be expressed. Now the advantage of doing this is that not many nuclear pieces are allowed to go inside, so that when the vitreoretinal surgeon takes over, a 3-piece intraocular lens should be implanted and a vitrectomy is done, and a pars plana vitrectomy can be done for the piece which has gone inside. So as you can see over here, basically, so you need SICS to help you whenever there is a complication in phacoemulsification, when you need extension to do this. So SICS remains relevant to us even today, where in cases where there is a hard black cataract, corneal opacity obstructing your view during phacoemulsification, pseudoexfoliation where there is subluxation. So SICS remains very, very relevant today in poor endothelial count, Fuchs dystrophy, post-keratoplasty cataract. Hence, SICS should not be considered inferior. It should be considered as a part and parcel of your armamentarium to do cataract surgery for any patient. And so it is very important to learn everything, to know all the techniques and use them to your benefit for the patient's welfare, to give them the best possible vision. Thank you so much. I think I finished in less than 4 minutes also, not even
Definitely,
5.
ma'am. Really thankful to you.